So, you might have twisted your ankle, fell off a ladder, or are generally feeling miserable. It might be a weekend and you can't see your regular doctor, or they might have no appointments, or you might have no doctor altogether. You're stuck coming to the emergency department. You're ushered in, sometimes through a metal detector, and you get to wait in line. A nurse might ask you about why you're here and take your vitals, and most of the time after that is spent waiting for a doctor to see you. Once again, depending on where you are, this could take a while, and you could be stuck waiting in a chair, hallway, or if you're lucky, or unlucky, in a room. You'll eventually see a doctor, and you might get some labs or x-rays ordered. You may or may not have everything explained about what's going on, and ultimately one of two things occur. You either go home, or you get admitted to the hospital. And most of the time, patients are left waiting around, and the first question they ask to us is why did they have to wait so long? And it's a fairly reasonable question to ask. You're sick, or at least you think you are, and you've come to the hospital for help. Unfortunately, everyone else around you has the same agenda, and there are only so many beds, nurses, and doctors to accommodate your needs. By law in the United States, the emergency department cannot refuse any patient the right to see a provider and get care. Which means if 40 people all have splinters in their fingers and you decide to come to the emergency department, then potentially that is 40 people who the doctor is busy seeing ahead of you. Even though a splinter in the finger doesn't seem like an emergency, and trust me it isn't, everyone has the right to get seen. If everyone used the emergency department for actual emergencies, we probably wouldn't need to have the discussion in the first place. Luckily some, if not all, emergency departments have a triage system. It's a system that uses subjective data, like if you look sick, and objective data about your visit, like the reason you came and your vital signs, and helps determine if you might actually be closer to death than the rest of us. If you truly have an obvious emergency, then there is a high chance that you are unlucky enough to get a bed and be seen by the doctor right away. Further complicating the fact is that there is a never-ending drive-through of patients entering an ER by way of ambulance, who also have varying degrees of actual emergencies, all vying for the same spot you have been patiently waiting for. A word of advice: although generally it is true that we are slightly more concerned about patients who arrive by the ambulance, by all means don't be surprised if you're directly sent to the lobby from your ambulance gurney if you decided to use the ambulance for a non-emergent reason. While these may seem like good or bad excuses for the ER to be busy, it likely isn't the reason you had to wait so long to get seen in the first place. What's worse is that it's something you probably wouldn't even have noticed. It's summarized nicely in one word: boarding. So what is it, and why does it affect me so much? Boarding is what occurs when there are no longer hospital beds in the hospital to accommodate patients who are admitted from the emergency department. Essentially, this is like throwing a bed away out of the emergency department altogether. Over time, if many patients are admitted without a place to go, the entire system can become jammed, because there's no active space to see any new patients. Many national groups, including the CDC, have measured average ED wait times, and when boarding occurs, wait times nearly double. The problem has continued to grow as baby boomers begin to age, as well as individuals whom are now insured by the Affordable Care Act come to utilize hospital services. It can take decades to build, permit, and approve new hospital structures and facilities, and the rate of need simply has been outpacing the rate of growth in many areas. This situation rears its ugly head as emergency department boarding time, and is keeping you from getting your broken ankle looked at. Believe it or not, we don't want you to wait in the lobby either. So you've finally been seen by the doctor, but you're still waiting. What gives? There are textbooks filled of hundreds of thousands of medical diseases you could have. However, only a few of those will kill you, and in all honesty, those are going to be the only diseases we look for when you come to the emergency department. Unfortunately, we don't have the time or resources to give everyone an answer for every single pain, bump, rash, burning, or why you don't feel good. You may have had some blood work or x-rays performed. Sometimes you may have even had a CT scan. These tests are by no means to diagnose you with a particular disease. Rather, they are done to make sure you don't have something life-threatening. These tests take some time to do, even more so if, say, your CT scan needs to be read by a radiologist. But keep in mind, we are performing diagnostics that would take weeks to have done as an outpatient. As medical legal pressures continue to grow, these workups also grow and continue to use more time. Admittedly, we're protecting ourselves as much as we are protecting you. But even so, there will be times when a deadly disease mimics something benign and it's missed. Even with the advancement of medicine and technology, even if we were willing to spend millions of dollars on every single person who stepped foot in the emergency department, there is no conceivable way to ensure that you will not die or have something serious 100% of the time. We try to strike a compromise, and it sometimes takes some time. I know that isn't the answer you waited so long for. I also wish you didn't have to wait so long for it. Our home is crowded and busy, but open every single minute of every day, every single day of the year. meeting people on the worst of theirs. If you need us, we'll be there. Please forgive the wait.